So I think this, discussion is more of oriented towards the doctors rather than patients. I want to urge everybody to, stop using hormonal pills for symptomatologies of polycystic ovarian syndrome or polycystic ovarian disease, or nowadays as it is called PMOS or Poly-Endocrine Metabolic Ovarian Syndrome. The symptomatology, is very similar in all of these cases. The names might be different, but eventually the patient is going to come to you with the symptoms of irregular cycles or amenorrhea. So just sticking them with OC pills just for that, mental comfort of having them cycles on a regular basis for 3 to 6 cycles is not going to treat the PMOS or PCOD or PCOS at all. The baseline condition needs to be treated first rather than just sticking them with endocrine tablets or hormonal tablets and giving them a false sense of relief that okay, my periods are coming on regular time and they are at a particular for a particular duration, so on and so forth. That is just an illusion, so to speak. So I've seen so many people come for second opinions and they have this huge files with them, investigations are done, all the hormonal tests are done. At the end of the day, nobody has been counseled about the diet changes and the lifestyle modification and the weight reduction and the physical activity. Very few people take the time to actually counsel such patients what needs to be done in order to have a regular period. Most often than not, these people are given hormonal tablets, whether the couple is desirous of conception, whether the couple does not want conception, nothing is taken into account. And all these, patients are taking OC pills since 3 months, 6 months, sometimes years altogether, just in the hope that, okay, if I stop taking these pills, my cycles will again become irregular. But the main point of PMOS or PCOS is that it is a metabolic syndrome and it's a metabolic disorder. So it needs an overall counseling. It needs, a holistic approach. And please stop labeling teenage daughters or teenage girls as polycystic. According to the definition written in textbook also, you cannot call somebody as polycystic ovaries or polycystic disease after and up until they have reached 8 to 9 years after their menarche or puberty. So all of these 16, 17, 18-year-old girls who come to my OPD with the diagnosis of, oh, I have PCOD and I have PCOS and this doctor and so on and so forth, they've prescribed this and that. And these ovaries are generally very, very immature. So the whole point of a teenage girl coming to you with irregular cycles is because their HPO axis, their hypothalamo pituitary ovarian axis, is extremely immature. And you cannot call this as PMOS or PCOS unless and until you've crossed that 8 to 9 years after the menarche. So please follow up these girls, advise them, educate them, do not stick them with OC pills. And it's definitely not a recommendation, by any textbook that they should give OC pills for treatment of PCOD or PCOS. OC pills strictly need to be used for, contraception purposes first and foremost, and maybe in some other conditions such as downregulation and ovarian cysts and all of these fertility issues. But as far as PCOS or PMOS is concerned, please, I urge everybody to not use OC pills as treatment. Thank you.